This is Dr. Vaishali and I'm reading from the book Structure Part 1. And the chapter name is Understanding of the Row 1. Hydrogen and helium are the two main components. Now under label Understanding of the Row 1. Conception and Existence. The issue in row 1 is of conception and existence. It is the moment of conception when two become the one, when from nothing a new life is born and when energy is crystallized into the matter. So far, they were not there at all. They didn't exist. Now, after conception, the question arises, am I or am I not? Do I exist or not? It is a question of unity or the duality. They seek connections with the form which gives them a sense of existence. Now keywords in the row 1 we have only two elements, hydrogen and helium, and both the remedies are not well proved. And keywords for the row 1 are like a baby without a body, consciousness, material form, exist, energy, ethereal, essence, six unity and united, split, aggravated by the loneliness, feeling of isolation and separation, fear, sensitive to loss. And the keywords of row 1. Expression of individual element of the row 1. Hydrogen. Property of hydrogen. Hydrogen, the simplest form of element and chief constituent of the most stars, furnish the fuel for the star like the sun, because the core of typical star is so violent and hot. Hydrogen nuclei are separated from their electron in the star's core under the great pressure of overlying material forces. The proton collide so violently that the nuclei of four hydrogen atoms fuse together to form a helium nucleus, liberating energy in the process and producing a star's light and heat. In this fashion, more than 4 million tons of the sun's mass is destroyed and turned into energy every second. Under normal condition, hydrogen is a gas. So we will also see some aspect like the weightlessness, feeling as if thin as air, freedom, light, desperation coming up in the remedy. And the hydrogen's most common isotope has one proton and one neutron in the nucleus and the one electron in the orbit. So there is a balance. Understanding of the hydrogen. Hydrogen exists at the meeting point of the row 1 and the column 1, where the structure of the existence has not started yet to form. It is a point between energy and the matter. Am I energy or matter? This is question. It is a stage before one is born. So the question is, do I exist or don't exist? There is also a feeling of isolation, separation, and no connection with the form. And with self or with the form and self or with anyone, hence they look for the connection to make them feel that they exist. Without this connection, they feel disconnected, empty, and sense of void. I have often observed the hydrogen patients saying, I feel extremely neglected, unnoticed, as if I don't exist for them. In such a situation, their ego compensates for this and they seek attention and recognition. Now the expression in the patients are, you are just the essence, you are just the energy, ethereal, like a baby without the body, issue related to consciousness and material form. And rubrics are, which is mentioned in the complete repertory, conflict between higher consciousness and worldly existence. Second, delusion, imagination's energy of powerful, moving according to moving around the air. 4-second feeling, isolation and separation of, fear, separation of. Now delusion, body separated from soul as if. This is also the rubric. Also stated by the Jeremy Sher in his proving, hydrogen was the first element to be formed in the universe. It is a link with the time. That was before a phrase from the Kalahari. It's not. It is the first born element in the universe, being both positive and negative and possessing the pattern or the structure first time. It makes all the things possible. It is the source, and it is the beginning of the energy and the matter. Now, case of the hydrogen, case of the 52 years old woman with recurrent urinary tract infections, knee joint problem, multiple moles on her skin, and neuroma of the foot, first seen in the January 2004. Now the dialogues are there. Doctor asks, so what is that is bothering you the most? And the patient says, both the knee, because it is just so chronic and it limits me. I want to do more dancing and I am fairly athletic. I want to run and I have to sometime walk with my body. Just below the point of injury, I feel very bad. I know it's going to be injured, so I can't make as much effort because of my injury. So that the chronic problem, but what I call the bladder infection I have had before, but maybe not for the 8 years. I don't understand if it is a big or a little problem. So as doctor asked, when you say that this knee limits me, tell me a little bit more about this. And she said, on my stronger leg I can jump very high. On the leg, can't. And this my injured leg can't jump. I had a medial meniscectomy, and it isn't as strong as the leg I used to operate. There is a little bit of atrophy in the muscles, and could never run full out for as long as what I wanted. I think my body is more capable than my knee allows me to do such things. If I didn't have the knee, I would be stronger, I would be faster, and it causes an imbalance. Gesture as if balance is moving. In how I can be physically fit on one side, can do anything on the other side. There is some limitation I don't like. That is a so imbalanced feeling. Patients, doctor says, tell me more about the imbalance. The patient saying, when I was little, I remember that I even had some kind of sensations, which I remember sitting in school and rubbing a pencil between my finger and wrist, like this action of rubbing wrist, and it's always had to be equal. So it is have something on this side, point to right side, then it has to be there on the another point. So even the simplest thing like the I couldn't wear a ring because it didn't feel equal. If it is in both hands, then it's okay, it's balanced. The moment I asked her about the balance, the energy that emerged a very interesting part about her when I attended your seminar. She is the doctor, homeopathy doctor, and when I attending your seminar, one of my sorry. When I attended your seminar, she is also studying the homeopathy and had just attended one of my seminar, and I show these cases. I identify with so many of them because all of them come to this conflict, means gestures as if balance is moving, and I think it's a part of me. I'm double Libra, so there is a balancing gesture as if balance is moving. There is so many point of viewing a balance. There is a physical, but what I think of right now is when you meditate and you become in a better state, that is being balanced. Most of the time I am not balanced actually. Gesture is as if balance is moving. I'm either too much this or too much that, and maybe you approach the balance more, but usually it is not perfect. It just feel more neutral. I have a lot of pain right now in my life. Like at the moment, the balance feels like a short of freedom from the emotional pain. I don't mean this is in a spiritual sense. spiritual sense at all, but I mean that everything is in the present, not in the future or in the past. I forget things really easily, and injustice done to me or whatever, I don't even really like to make plans in the future. I just like to see however the world is now and what is the present moment, and I like this. Even when while traveling, if it is become too difficult, I just take another path, and I can't say a lot about that. I just felt more balanced. When a person persists in speaking in human term, then I will bring them back to the non-human terms they have used by asking them to speak more about them. This is the statement of doctor. In this case, the word balance is more important, so I proceed to ask her more about this word balance. I ask again, describe balance, just the word balance. The patient say, you know the scales that you have, they have to be equal both the sides, but it is something in between that allows them to be equal. Have an image that comes to the my mind that there is a point and the scales hangs here and there, a force in the scales that holds these and the force that holds in balance. I know this force very well. I think it's a something rare and I sense it. Sometimes I know things, but I don't know how to communicate with them. And when I say, I just take myself that I feel good or bad, feel happy or sad. There's something that's balancing in between those two things. I think you can feel it actually physically in my body. Sometimes it feels neutral. She said this is one force which make me balance. Doctor say what is neutral, and patient say neutral is between positive and negative. I don't know what it is. I seems like neutral can go to either positive or negative. Maybe it's made up of the both positive and negative. When I think of the child being born, then you have the father and the mother, the male and the female, and in the electricity the proton and the electron get together and make a neutron. Like mother and father make an electron get together and make a neutron, like a mother and father make a baby. I think maybe that is to do with the neutrality. I think I have a sort of hunger to be neutral, even the work more to be neutral. I seems like there is a process involved. Now the understanding of doctor is what? Now she is talking completely nonsense, which means she is talking directly about the source word. The way it comes out is so strange, from the problem in her knee joint to balance to neutral and then to this. It seems to be like a birthplace, neutral, because I have experienced so many things in my life. Patient says, I have experienced so many things in my life. Example, you are very shy, you go to a certain neutrality, then something happen and you have the capability to something else and be bold, but it can go back again. I don't have control at all the time. It can go back and forth. Maybe neutral is where you could control it. Now I want to be alone. Now I want to be with people. Now I'm this and now I'm that. And that's how I perceive my life. I think this things just happen and I am in it. If I don't want to be social or maybe come out by social or something, then you are just stuck there. I mean, you can make an effort and maybe come out, but sometimes it's hard. If you are neutral, then it's not so hard. It's balance. You can come out. At least you have a chance and opportunity. It's a place of choice. It is a place of freedom. You can be controlled instead of it's being in a control of you. So he's telling about simple balance. And doctor asked, and when would it be control of you? And she say almost all the time. You walk down the street and someone smiles at you and you smile back. And someone else throws a tomato at you and you get angry. You are just in a reaction all the time. What's happening? Then doctor asked a bit more about neutral. Tell me. And she said, well, I said have to conjecture. I have to conjecture things, but I think that it's place where it's like a void. But everything is in at the same time. Void is just a big hole and there is nothing in it. It's just empty. It's like a vacuum. Anything and everything can go through because there is no resistance. It's just go. go in. Maybe it even just attract everything. Now the understanding of doctor is what? So far we have no idea what she is narrating, but to her this makes perfect sense. And often when I am walking, I have a doubt. This sounds so abstract. What is all this? It is so abstract. Where is this going? The best thing is to just stay with it, and when you come to a point where the absolutely make no sense, is the senseful. Then doctor asked, so what is the experience of that vacuum? She said, feels safe. It could be safe, but it is not protected. That's why everything can come in good and bad. Unprotected. She cries at that time. I can feel not protected, but I don't know what the world is. Probably alone. It's like a void. Well, I know what it is like to not be alone. To not be alone is to be just in your family and to be supported and supports others people. There is a mutual support like reciprocity. It's balance. It could be anything towards your feeling. It can be their idea what your families your kids do and whatever they want. And doctor asked, what is support? And she said, support is a structure. I think it is something you build. Maybe it's like a trust. I don't feel I'm making support in structure. I think it's something you build. Maybe it's like trust. And doctor understanding is what? In my mind, I ask which of this kingdom she is talking about. I may not recognize the source at that point, but I'm getting an idea that she is speaking mental language by her use of word structure, build, vacuum, support, and balance, everything. And then patient said, I don't feel I am making a lot of sense out of it. Trust is mutual, sort of respect between two people. Maybe reliability, trust has to do with the faith sometime, which can be gift. I guess both, but it is a sort of calmness because everything that comes to you is what should be there. Calmness feels like a peace, not perturbed. It's a mental and physical. You can be shot and tortured by being perturbed, and your mind can be shot and played with by the force and its register in your body. It feels awful, like you have no control. It feel like it possesses you. It makes your body want to move too, but it is not comfortable. It is not like a beautiful dance movement. It is just like an awful nervous energy. Gesture of the clawed hand shivering near abdomen. Doctor asked, describe the sensation there. And she said, something want to burst out to be free. I think it's just uncomfortable physically, and it's centered in my solar plexus. It's feel like the cells are covered with the poison and you want to get out, and there is a connection with the mind. It's a perturbed also, but maybe the same way. This feels not comfortable, not at ease, and like it was making up a dance. What would this mean? Doctor asked, no, not the dance, just the hand movement. Explain. And she said, what is my hand? It is the freedom. This is the gesture of hand facing each other and moving apart. It has more space. It's a calm. It's open. And she repeat the gesture 2 times. And I have an image like there is no pollution like a mountain air. It's a nice, light, not heavy. It's a free. And doctor asked, describe light and little bit more about this. And she said, well, light is feeling that I like. For example, it is very jarring things when you are running like this, but it is not what I like. I like it when you are in the air and in the between the steps. I like to dance. It's the same, and the body really light and feel free. I like height. I like to be in this thin air on top of the mountain. It's a light. I like the feeling in my body when it is a light. If you gain weight, it's really uncomfortable. Yes, it's a free to move. No resistance, no boundary. Gesture of the hand facing each apart and moving apart. If there is a resistance, it can't. It can permit go through the boundaries, and it is calm. And then doctor asked, again you showed like this gesture of hand facing each other and moving apart goes to the boundary, just describe it more. And she said, well, it's just free. Even when I do it right now, I sort of see a cell, but it can go. You no air can pass through it, fluid can pass through it, and anything can pass through it. Even if there is a wall or the boundary or the border, it can still pass through it because it's a free. Now doctor says, what is the opposite of the free? And she said, restricted, stuck, not permeable, tight. I don't like it. It's uncomfortable. Poisonous too, and it can be poisons others too. And doctor said, what can poison? The patient said, the tightness. If you smile at someone really nicely and they smile back at you, it is the same. If you tight, then something you can give that to someone else, and also even if you don't want to. Doctor asked, she had mentioned in the case form that she is undergoing divorce, so I choose to ask about the situation. Tell a little bit about your situation, especially with your divorce. And she said, well, I am right in the middle of it. I am negotiating things even from here, and I have been in the process of 4 years. Well, we have business together, so we were arranging about what to do with the money and of our business, and I am afraid of losing my children a little bit. I think that probably the best things that I have done ever was to be mother and stepmother. I have been impeccable. IMPCCABLE. I don't know what is this. I have been great, and I am little bit afraid now. Sometimes I don't know, I am just afraid I will lose them. Everything that I have worked for in this 16 years would just be gone. And doctor said, what would you experience if it all were just gone? And she said, sad, and it's awful. Alone. It is so tingled with the self-pity. It's hard to say. Alone. And doctor said, tell about this feeling of alone. And it's scary. I can feel something in my body right now. It's short of the same. Lack of the freedom and lack of the comfort. It doesn't feel good. I feel like a poison again. All things are poison. That put inside a drink, and I feel better. It feels bad, of course. It scores everything, and then you just want to get out of it. Just get out of it, escape and get free. Doctor said, what is the opposite of get out? And they said, stay in. Action of placed hand close to the body. Stay in. Then doctor asked, what are you showing with the hands only this much? And she said, the boundaries. Something in here, the fist wants to get out of this restricted area. It's okay in there. It's okay in there. It is fine. But it is want to become out because it has this poison on it. Action of twirling finger around the fist, and wants to get out of that and restrictions of that, so it can be free. Doctor asks, so what can the things do to it? And she said, it restricts it and make it feel bad. Here understanding is what? Here the word poison is not very important, but she makes certain gesture when she speak of poison. So I focus on the energy rather than the word used. And normally I would associate this poison with the death. But she doesn't say that. What she says, it is a restrict. So that takes the word poison out of its usual context. It just can't get out. There is no freedom. It can't feel normal, or it can feel anything. It is there. It is blocked. It is nice. It is nice in there. It is light. It is calm. It is free. But it is nothing too. It is just like a sense. Essence is all that is necessary. Then doctor say, what do you mean by the word essence? And she said, I don't know. It's a life. It's being. It is the only things that really essential, and nothing else is essential to that. Maybe I think it's just like a baby without a body. I don't know. I am just talking, but it's like you are going to make a baby. The body probably surrounds this, and then it's born. That's what is essential. It is like life, and then when the baby is made, it gets a body and surround this, and it's born. This is what's essential. It doesn't matter if the body, if the baby has blue hair or has no arm. It doesn't matter anything. This is what is essential. What is it is what in here, action of hand cupped and closed. It is a life. It is just a life force. Repeat the same action and some kind of energy. I feel there's some kind of energy. I don't think it has anything written on it. It's just a life force. It doesn't have any program on it. It doesn't have any chromosome or nothing. It just is. Then doctor asked, and then what happened to this life force? And she said, lots of things happen to it. It gets programmed.